Thank you, Mr Deputy Speaker. This government's budget rips $80 billion out of health and education. It's setting Australia's health system back 50 years. I've always believed that the Prime Minister looks for inspiration from the past, and we're seeing that in what he has done in this budget. But in actual fact, this government's waging war on the health of Australian families by attacking the universality of Medicare. It's a war that Tony Abbott or the Prime Minister began to wage when he was Minister for Health. I remember the days when he stood up in this chamber and he gave roll gold guarantees that he would not touch Medicare. I remember the days when he stood up here with a smile on his face, smirking from ear to ear, saying, "I'm the best friend that Medicare ever had." And we know that the more he says something like that, the less you can believe it, because the Prime Minister has made an art of saying one thing and doing another thing, presenting a case that he believes one thing when in actual fact he believes something else. In the days when the Prime Minister was Health Minister, bulk billing rates in Shortland electorate went under 60%. When we came to government, when Labor was in power, bulk billing rates rose over 82%. Now, that says to me that Labor, the opposition, is committed to ensuring that those people that need health care can get health care when they need, because when the doctor bulk bills, a person doesn't have to make a decision about whether or not they buy food to put on the table or whether or not they go to the doctor when they're sick. I know the Prime Minister's always believed in a US-style system. Millions of residents in the United States have absolutely no health insurance, and they can't afford to go to the doctor when they're sick. Earlier I heard the Minister talking about credit cards. Well, this government wants to make the Medicare card useless and force patients, Australians, to use a credit card when their credit card when they get sick. It's bad health policy. It's really bad health policy. Good health policy encourages people to be involved in preventative health care, not to just react when they get so sick that they've got absolutely no option. Because if you've got to pay to go to the doctor, then people will put off going. In my electorate, it's a very old electorate, a number of people there suffer from chronic diseases, and they've been able to put in place good health care management plans, and they are a lot healthier because of the Labor government and the health policies that we had in place. Under this government and the cuts in this budget, the incentive will be for people not to go to the doctor when they're sick, only to go when they're in a critical condition. This co-payment will have such an enormous impact on the health of this nation, and those on the other side of this parliament just don't get it. When Tony Abbott was in power as Health Minister, he commissioned the then Health Committee to inquire into the funding of health, and they brought down a report, The Blame Game. Now, what's happening now is that we're moving back to the blame game, back to a situation where the Commonwealth is passing the costs for providing health to the state. And you have people like the Premier of my state, Mike Baird, the Liberal Premier, saying these impacts start on the 1st of July, they can't absorb them, they'll have an immediate impact, and that immediate impact is really going to hurt the people of Australia. This government stands condemned for its
Order.
health
Member's
policy.
time